Okay, so we'll go ahead and get started. So I work at Area 10 Agency on Aging. Again, my name is Liz Jones. And we are a nonprofit that's been around since the late 1970s with a mission of serving older adults and people with disabilities. And we're part of a national network. So wherever you or a loved one may be in the United States, there is an area agency on aging that serves you. We are funded through the Older Americans Act, and Area 10 is one of 16 agencies on aging that serves Indiana. And here's the fabulous state map that shows how this is broken up. Area 10, we serve Monroe and Owen counties. We offer a variety of services. There is some difference depending on which agency you're going to. The size of the agency may have an impact on the services offered. But, you know, as a general rule, there are programs to assist with nutrition, housing, transportation, volunteer opportunities, help with Medicare, in-home services, and more. Those are the basic things that area agencies on aging offer. So what do? I'm going to be going into detail about all of the different services that we offer. The program that I mainly work in is the Aging and Disability Resource Center. And let's get into that. This is really your one-stop shop. If you've got a question, if you've got an issue, if there's something you don't know how to handle, don't know where to turn, you don't need to pull your hair out, open up the phone book, start Googling online, you can call Area 10. Our Aging and Disability Resource Center has a clearinghouse of information in the community, different resources that offer assistance to older adults and people with disabilities. And so really, if there's anything you take away from my talk today, just knowing that we're a resource to turn to. Rural transit. This is a bus service that Area 10 offers. It is for people of all ages. There are express routes where they have different stops out in the counties. There are also door-to-door services. This is also a Medicaid transportation provider. So if you're providing caregiver services to someone who is on Medicaid, Medicaid will pay for transportation. You just pay a $1 copay. Rural Transit is one of those providers. And you know, for people who can no longer drive, who still need to be able to get out and get to appointments, who don't live in a city that has a public transportation system, Rural Transit is that alternative to help folks. Housing. Area 10 manages several different housing complexes that are for people who are 55 and older. The Dodds-Wiley Court in Bloomington, Edgewood Village in Ellettsville. If you've ever been to the Area 10 offices, these apartments are right across the street. Patterson Point, Area 10 does not manage these apartments, but we have a relationship where we're going to have services offered on their site. Then we also manage QNOT apartments that are in Poland, and that's in very rural Owen County. But again, for people 55 and older, they have things like grab bars in the bathroom, more accessibility type issues are addressed. And then the Enright Center. Again, if you've ever been to Area 10's offices, right attached to Area 10's offices is the Enright Center. There are card games, computer classes, craft groups, painting classes, exercise equipment from cardio to free weights. And there is a fitness specialist who will work with people to come up with a fitness plan. We'll show you how to use the equipment, and it's free for anyone 50 and older who lives in Monroe or Owen County. So just a great way to come and be with other people, to get together, to get out, to have some recreation. Case management and in-home services. This is a piece when you have questions about who's going to pay for this. These are subsidies. We administer different funding streams that have different eligibility criteria. But ultimately, their purpose is to help people remain independently at home, to help provide respite to caregivers who may need a break to be able to get out and do some other things. These programs can help with bathing, dressing, medication management, just having someone there to supervise, homemaking, meal preparation. They all have different eligibility. For example, one program, you specifically have to be on Medicaid. It's called a Medicaid waiver. There's another program that you specifically cannot be eligible for Medicaid. You have to apply and be denied. And so they're all a little different. I've heard some people say, well, I'm not going to call Area 10 because I don't think I qualify for anything. Please call us. We have a lot of programs. I would hate for someone not to call who could be eligible for something that really could offer some support. And so the way that these services work, a person who needs assistance will call Area 10 and they'll speak with one of our options counselors, which is me, Holly, who you've met, and Heather. We'll do a phone assessment, and then a case manager will come out and do a home visit. And this is where we're gathering information that we need to see who qualifies and what you might qualify for. And then from then, depending, some of our services have a wait list. So we try to create volunteer programs that can help offset some of those wait lists, but depending on the service, depending on the funding, that can be an issue. But this, this is, I would say, the wave of the future, because most people want to stay in their homes as long as they can, if not, until the end of their lives. And so programs like this are really helping to keep people where they want to be while receiving the services they need to be safe and well cared for. Nutrition program. We have several different programs to help meet the needs of older adults and people with disabilities. We have some meal programs. We have home delivered meals for people who are homebound, who can't get out of the house, who have difficulty with meal preparation, who may rely on a caregiver for meal preparation. This could be an opportunity of respite for caregivers. And depending on where a person lives, this is mostly volunteers who are delivering these meals. And we've had to shift things around. If somebody's way sort of off our usual route, we may just be able to deliver a frozen 5-pack of meals. Or we may just be able to deliver Monday, Wednesday, Friday, and 2 of those meals are going to be frozen. So there's a little bit of flexibility just because we're doing the best we can to serve everybody we can. We also have congregate meal sites, and these are meal sites throughout Monroe and Owen County where older adults, 60 and older, can come and eat a lunch, to be in a social atmosphere, to be together and have a nutritious meal. So that's more for folks who are able to get out. We have a food pantry that is, again, for people who have difficulty getting out. They're homebound. Getting to the grocery store is a hardship. This is a monthly delivery of a couple bags of groceries. And depending on what we've got, sometimes we have some things from our garden that we've been able to include fresh produce. We get a lot of our items through the Hoosier Hills Food Bank, so depending on what they've got going. It might be some fresh bakery bread. It's always canned goods are involved, but sometimes we've got eggs. It just depends. But this is a monthly delivery. Then we've got some voucher programs with a couple of local restaurants, the Village Inn restaurant in Ellettsville and the Steinsville Mercantile in Steinsville. We've got lunch vouchers where you can get up to 10 vouchers a month that are good for a meal, breakfast, lunch, or dinner. And it's from a special menu. It doesn't have fried chicken. It's got a healthy, well-balanced menu that you can choose from. But again, 10 vouchers a month that are good at either of those restaurants. We also participate in, and this is a federal program, through the U.S. Department of Agriculture, the Farmers Market Voucher Program, where the federal government gives us vouchers for eligible adults who are 60 and older to go to the farmer's market and buy fresh produce. And this year I think it was $20. Each year it varies a little bit, but I think we still have some of those left, so give us a call. And then nutrition education. We have different programs that happen at the Endright Center, just things about, they had recently cooking for one, different menu ideas, cooking for a person who has diabetes. So we have different, on a varying schedule at the Endright Center. Okay, our RSVP program is a volunteer program for anyone 55 and older. This is a way to match people with areas of interest, things that you're passionate about, groups that you're drawn to help. We have volunteers working, more than 450 volunteers working in more than 100 different local nonprofits. So this isn't just volunteers helping Area 10, this is all over the community. And really, again, a way for people to find ways to be engaged. And there are varying levels of activity for somebody who isn't able to get out of the house. There are opportunities for phone volunteering. So it doesn't have to be somebody who needs to be able to get out and go and be somewhere. It can be something in the comfort of your own home that you're able to do. Caring Companions. This is a program that has expanded greatly as some of our programs have had wait lists. We've really worked on trying to find other ways to help meet people's needs. And the Caring Companions program has really helped do that. Having a friendly visitor. For somebody who is homebound and isolated, who may not have a lot of contact with other people, it can be somebody who comes and visits once a week, once a month. Somebody who comes to play cards, comes to play chess, comes to just talk and visit. It's really about matching people. Telephone reassurance. Getting a friendly phone call from somebody. A happy birthday message from someone. Again, just a way of reaching out to folks who may be very isolated. Somebody who may have a pet, which we know can provide a lot of unconditional love and support and companionship, may have some hardships with cleaning out the cat litter, making sure the dog gets a nice long walk. So we've got volunteers who can help with that. Housekeeping. That's a little more of a challenge to find volunteers who are ready to pitch in and dust and run a vacuum, but we do have them. They're harder to come by, and it's definitely a need because that's when we have people calling us for help, that's one of the biggest things they need help with. They can't run the vacuum anymore. They can't haul their laundry or change their bed. And so we're always looking for folks to help with that. And someone to run errands. Now, our volunteers can't transport somebody and take them to the grocery store, but they can get their list and do the shopping for them. And again, that can be a great resource to give some respite to caregivers as well. The money management program that we offer is through AARP, and we have highly trained volunteers who help people with money management, from the extreme of being a representative payee, helping literally someone manage their money and divvying it out to them, to somebody who just needs help making sure their bills are paid each month, helping them balance their checkbook, making sure they're not missing anything, helping them save for something important coming up, but really just a person to help make sure the bills are covered. And this can help, if a family's concerned that somebody's, the electricity got disconnected because the bill, was sitting on the table and just never got mailed. This can be reassuring, and again, it's a volunteer who's there to help. Our repairs team, reliable experts providing accessibility, independence, repairs, and safety. I'm glad that's spelled out because my brain just has never been able to remember that, but I think it's so clever. Holly actually came up with that. This is a group, again, of volunteers who do minor home repairs. The toilet won't stop running, the sink is leaking, I can't reach that light bulb to get changed, or I need to get my batteries changed in the smoke detectors. 2, I need grab bars installed in my shower, in my bathroom. I need a steady handrail by the steps so that I can hold on. I need a wheelchair ramp. Things to help make the home more accessible. Now, they don't do major home repairs. The roof's caving in. Call Area 10. We can send you somewhere else. But our guys, that's above their pay grade. They don't get on high ladders, but they'll do the little things that really can help folks, again, be safe and independent at home. The long-term care ombudsman. This is a position. This person is an advocate for people who are living in nursing homes or local assisted living facilities. This is the voice of the resident. So if you ever have a family member, a loved one, someone you care about who's in a facility and you've got concerns, you feel like maybe their rights aren't being respected. It could be anything from a visitor who's being denied, or problems with a roommate, or even family disagreements. The ombudsman is there to make sure that the residents are being well cared for. They go periodically to visit the facilities, visit with residents, introduce themselves, because a lot of people aren't aware of this program. I know years ago when my grandmother was in a nursing home, she had had a stroke, and she wasn't conscious at all. But she had family regularly coming to visit her, and there was an issue. She'd get her hair done, and then the next day was the day for her shower, and her hair would get all messed up. Like, okay, what's the point of getting her hair all fixed? We didn't know about the ombudsman, but this would have been a perfect issue to take to the ombudsman. Whether it's something you consider a small thing to a large thing, that's really what this position is here for. Now, here's a big one. SHIP. We're here to help with Medicare. Open enrollment is coming, which is the one time of year most people can make changes in the prescription drug plan or in their Medicare Advantage plan. It's October 15th through December 7th each year. So give us a call where we make appointments. We are objective. We don't sell insurance. We don't get a commission for signing you up for this plan or that. Our objective is mainly to help you find the best option that's going to meet your needs for the best price. And so we always encourage people to look. I help my parents every year. Most years, there's a better deal because these plans are always changing. We also do Medicare fraud awareness. We do workshops around town showing people how to look at your Medicare summary notice to make sure that there aren't services being billed that you haven't received, to help empower Medicare beneficiaries to be the patrollers of Medicare. So that's what the Senior Medicare Patrol is. And that's pretty much everything we do. But again, I want to encourage you to call us. If there is anything you're not sure about, you've got questions about, you're confused, you don't know where to turn, we're really there to help. So, yes?
I have a question. On that Enright Center, what was the age on that?
50. 50 and older, yeah. You do have to get a doctor's note saying that you're physically able to exercise, but once you've got that, you're ready to go.
I just looked that up online, and then there's a form I see you can download.
Yeah. Any other questions?
What does the doctor's note have to consist of?
It can just be even a prescription slip that says John Doe is safe to exercise. I've gotten one. I'm allowed to work out there.
And so, and on the Medicare enrollment, if you're enrolling for the first time, then if you have had health insurance through an employer, you have a window of opportunity to enroll after you no longer have,
Yes.
so that's sort of an a single open enrollment at that time of change,
Yes.
right?
Yes. We help people who are new to Medicare for whatever reason, who are wondering, do I do a supplement? Do I do Medicare Advantage? What drug plan? That people who are overwhelmed with all the things they're getting in the mail. We hear a lot about that because every company says they're wonderful and the right one for you. So it feels very overwhelming. So we're absolutely there to help new folks too.
How soon before you sign up for Medicare should we come and talk to you for advice?
Well, you can technically sign up for a plan 3 months before to 3 months after your Medicare is going to start. So it would make sense any time in there. As far as the open enrollment, if you're already on Medicare, we're going to be getting a calendar set up. I would say by early October, we should have that ready to start plugging in appointments. Yes?
Do you do any kind of a check on the background check on the volunteers that will be going into the different homes?
Yes, all the volunteers have background checks. Anyone that is working, staff and volunteers have had the background checks, and it's an ongoing process.
Where's the area 10 in Greene County?
In Greene County.
10 in Greene County?
That agency is out of Vincennes. They serve several counties, I know. But if you call Area 10, we can get you their number. Any other questions? Well, thank you all for being here and for listening, and I hope you call us.
Take your microphone and your clicker.
Yeah.
All right, so I just had a few more things to talk about. The bulk of what we wanted you to know about is what is available at Area 10, because I too hear people say, I don't think we qualify for anything there, and I say, just call them and find out, because I bet you're wrong. So there may be some things that, are less available to certain people than to others, but often there are things that you say, oh, I didn't even know that you had that. So that was the bulk of what we wanted you to hear. But other than what Area 10 has, we wanted to make sure that you guys were aware of a few other things too. And I know I went over those pink sheets, and so I won't belabor those again. But I did want to define some of those things a little bit better for you guys and talk a little bit about finding information on the internet too. Can you finish handing these out for me so I can just chat? So. All right, so I talked before about how there was some intermediate care in between home. Were you going to ask a question? Oh, I thought you were waving at me. Between home and nursing facility. And so I wanted to talk a little bit more about what those are. Because I think sometimes we hear those words and we don't really know what they mean. But a big one of those, we heard just a little bit about from you, is private duty care. So Area 10 does provide some of that stuff. You heard her talking about housekeeping services and pet walking and those kinds of things. But even if you're not one of the people who does qualify for that particular service, that is something that's available in our community. So if you look at that pink paper, those should be listed on there. Most of these, if you're not going through Area 10, are pay for service. A couple of the companies in our community do accept Medicaid waiver. So if you have somebody that's on waiver, that could be an option as well. So if you're thinking, oh boy, out of pocket's just not going to do it, you might want to call Area 10 and see if you qualify for that waiver that might help with those. But typically, private duty care is any kind of non-medical care that you can think of. They're not going to have a nurse or physical therapist or anything like that, but these will be the people that can help you with things like grooming or grocery shopping or being able to get out to the golf course if you want to go golfing. They can do pretty much anything that you would need help with day to day that's not medical in nature. Another option to help out caregivers and to help out those being cared for when they need a little extra social interaction is those adult day programs that I had talked about. So these are programs where you can actually go usually into a facility and spend the day interacting with whatever activities they have going on that day. Make sure that you get a nutritious meal. There is a nurse on staff there usually saying, hey, time for those meds, making sure they get those right things, but where you would actually go home at the end of the day or after a half day or whatever. We have 2 nursing facilities here in Bloomington that provide that adult day programming. There is one in Owen County that I know of, unless others have popped up. And then we actually have one that's specifically geared to Alzheimer's disease that meets twice a week here in town.
Where?
What? It's called the Better Day Club. So I don't know if any of you knew Kathleen Weber, who... Well, it started and it's on hiatus and will restart in October. So, but she does 2 partial days. So depending on what your needs are, there are programs out there that can fit most needs. In Bedford, I know that's not one of our Monroe and Owen counties we're talking about, but they actually have an adult night program as well. So if you're somebody that works crazy hours like nursing or newspaper or whatever, that you need help in those overnight hours, they actually can do that at the Garden Villa in Bedford. I don't know if I mentioned that one on the pink sheets or not. I think I did. I did? Okay, good. Usually this program is self-pay as well, and that fee does vary. However, some long-term care insurances can cover this. So if this is something you're interested in, I would encourage you to call. If you have your long-term care insurance, call that company and say, hey, is this something that can be covered? Because that can help with a lot of that day-to-day care, leaving us not feeling so overwhelmed, even if we only use it from time to time. Another option is respite care. Has anybody utilized respite care in the past? Respite care is temporary residential care in most cases. Sometimes it can be in-home, but often when we're talking about this, it refers to care in a facility. So this is something where perhaps an emergency comes up, or you're having a grandbaby out of state and need to leave, but it would be very difficult to bring that person with you. You can actually have them go to a facility for a limited amount of time, so maybe a week or 2 weeks or something like that, without being admitted to that facility and able to return home at the end. Again, a lot of times this is self-pay, but if you are caring for somebody on hospice, there is actually a hospice benefit for respite care. So if that is something that you're coping with, make sure that you talk to the people that work for your hospice, because they will help you be able to access that and the funds for that. The last thing I wanted to mention was support groups, and I know that you know what those are. But I also wanted to encourage you to talk to Area 10 and other places that you know of about these, because there are a lot of them in our communities here. I actually run 5 Alzheimer's support groups here in town. There are 2 Parkinson's disease support groups that I know of. There are cancer support groups for the patient, but there's actually a new cancer caregiver support group that's starting through the Alcott Center. There are lots and lots of support groups out there, and typically these are things that are free of charge. I don't know of any support group that charges, but often there are things you can kind of come and go into, and so it's nice to have the support of not only professionals, not only family members, but people that kind of know what it's like to be in your shoes. And then the last thing I wanted to touch on was online resources. How many of you got a diagnosis for yourself or a loved one and said, what the heck is that? And the first thing you did was hit Google or WebMD or whatever, right? That's the natural reaction nowadays. And so what I wanted to talk about was, how can we find credible information on the internet? Because there is a lot out there. And some of it's great, but some of it I read and I go, I don't know about that. That seems a little bit sketchy to me. So I wanted to talk a little bit about how to find those websites that are legit. One really great way to do that is to see who are they tied to. Finding a website that's attached to like a major institution like a university or the government or a well-known nonprofit or something like that is usually a good way to find solid information. Typically those websites will end in the .org, .gov, or .edu. Usually if it ends in one of those, you're doing okay. All right? Most of those are well backed by research and People know those institutions, so they're not going to just put any old stuff out on the web. Not to say that those things that end in .coms and those other things are not good information. However, if you do find information that's not on one of these websites, one good way to vet out what's good and what's not is to see, what is this website about? Are they trying to sell me something? Because a lot of times that will skew the information you're getting. Okay? I know when I read a study about a new drug, I always look to see who did the study. Because if it's that drug company, I want a second opinion. Not to say that their research isn't right, but they've got a motive there to sell me on their information. So what is the aim of that website? Another good thing to look for is, do they provide the actual research or references from the source of the information? So if I'm reading on something and they say, as seen in this, published in the, American Medical Association's journal with a link, that sounds a lot more credible to me than studies say such and such and such, right? Here are some websites that I thought might be helpful to you. Again, not an omnibus list, I know. The Alzheimer's Association I put up there because it is just a wealth of information. But I really put it up there because I wanted those of you who are caregiving for somebody with Alzheimer's or another dementia to know about this second website here. Do any of you know about Alzheimer's Navigator? Oh, I wish everyone knew about it. If you go to that website, alzheimersnavigator.org, this is a great tool to use when you're communicating with that team of yours, especially when they're spread out. So with Alzheimer's Navigator, you have a little questionnaire that you take at the beginning. It's maybe like 5 or 10 minutes long. And it gives you a list of action steps to do based on what you already have done. So it might say something like, follow this link and read this information about X, Y, or Z. Or it might say, talk to an attorney about power of attorney paperwork, or whatever the case may be. Ask your physician about this issue. It gives you very concrete action steps. And you can actually add other people in your family, friends, whoever that are involved. You can add them to your Navigator list. So they can all check in, they can all see what's going on, and they can check off tasks too. So it's a really great way, I think, to delegate those tasks and to know, what do I do next? So if you haven't been there, just go on and even play around with it, see what it looks like. It's very simple to use if you're a web person. Area 10's website I put up there as well. I won't go too much into that since you got that already today. CDC is a good place for wellness and health information. The Family Caregiver Alliance, have any of you been to this website? It's another wealth of information. They have lots of articles about things. They also have online support groups that you can be a part of. The caregiving information varies. So sometimes it's just really general about caregiving in general. Sometimes it's specific about certain diseases, those kinds of things. The Medicare website, they have a page devoted to senior services on there as well, but I think just the general website has a lot of good information too. National Council on Aging has a general website with all kinds of aging material. And then they also have this benefitscheckup.org, where you can go on there and see if there are other benefits that you should be looking at to qualify for you or for your loved one, or if you should, what kind of Medicare Advantage plan should I use, or whatever. It helps you kind of walk through those things so that you know what is the best fit for you. And then the National Institute on Aging is another great one that's run by the National Institutes of Health.